Welcome back, everyone, to another in-depth session at the Geneva Health Forum, this time focused on Geneva and its response to the current health crisis. Leading us through this discussion is Sana de Courcelles from the Permanent Mission of France to the UN based in Geneva. She is joined by Antoine Flahault, Director of the Institute of Global Health at the University of Geneva, and he's also co-president of the Geneva Health Forum. They both join us in the studio now. I'd like to welcome them and let the experts take the floor.
Good morning, good afternoon, good evening to all. Bonjour à tous. So I'm Sana de Courcelles, a teacher and an expert in global health and currently a health counselor at the French Permanent Mission. And I'm very pleased to introduce this and moderate this session today, together with Professor Antoine Flahault.
Good afternoon and good morning for all of you.
We all know the essential building blocks in controlling health crisis. The ability to analyze a health situation, to understand the kinetics, and to design a package of actions to prevent and treat people against a health burden. But the main challenge is to do that in a context where the film script evolves while the actors play their own roles, where researchers mobilize to advance science, where political leaders take decisions to limit the spread and the effects of the crisis, where citizens act according to stimuli and sources that are more and more numerous and even contradictory, and where health professionals, whose commitment of the front line we applaud, act to support and care for the sick and the patients. And in a world when there are no borders for the COVID-19, but there are still strong borders in minds and in reality between countries and regions. This context constitutes a break in the fight against a disease which needs to be fought a common front and where tools must be deployed everywhere to have beneficial effects for all. One place represents hope to think and act together, to collaborate, to exchange ideas, and to accelerate and step up the fight. This place is Geneva. We propose in this session to bring to light people based in Geneva who contribute to bringing essential information and operational proposal to fight against COVID-19. Today, we welcome 5 speakers from the EPFL, from the CERN, from UNITED, from FINE, and from the Global Fund. Welcome to all of you. Maybe we will start with a simple question to better know about your organization, if you can present your organization and present your work in these particular times. We will start with Christine Schwora. You are the Chief Health Data Scientist, Swiss Data Science Center at the EPFL. The floor is yours.
Yes. Thank you so much. Yes, so I will be speaking in the name of the Swiss Data Science Center, which is a joint initiative between EPFL in Lausanne and ETH in Zurich. And as a joint center of 2 schools of engineering, we are working with domain experts in terms of the data science tooling that we can bring to the community and to the public.
Thank you.
And
go ahead. Sorry.
No, sorry. I had some echo. Sorry.
Manuela, maybe from the CERN, if you can present what you are doing in these particular times and your organization.
Yes, I feel a bit like, the exotic bird in the room because CERN is not certainly known as an actor, in global health. Our core activity is basic research in particle physics. So you heard about the discovery of the Higgs boson, all of these, weird particles that nevertheless play a role into our universe and the way that our universe behaves today. So this is what we do in normal times. I'm a physicist at heart, but also since 10 years I work in what is called the knowledge transfer, means transferring certain technologies to other domains. And in particular, I coordinate the medical applications activities at CERN. And since the end of March this year, when the laboratory went into what it was called the safe mode, meaning that we were only running, let's say, the safety necessary operations, and everybody was working from home, we established a task force dedicated to the fight against COVID-19, because there was really a surge of ideas and of willingness to volunteer to find solution, both in terms of medical devices or computing, etc., from the 17,000 scientists at CERN and in the worldwide community of particle physics.
Thank you, Manuela. Maybe we'll go to Philippe Dunton, the newly appointed Executive Director of United. Philippe?
Thank you, Sana, and good afternoon, good morning, or even maybe good evening for some of us who are listening to this. Yes, I mean, United is working closely with a lot of participants today, the Global Fund, even EPFL. And basically what we are doing is to organize access to innovation in terms of health, looking at fighting the three diseases, but also women and children health. And basically what we are doing is to push innovation to make access to drug or diagnostic more simple, to accelerate the response, but also to transform access to care for the people, but also to ease the work of the health workers or the communities. So we have been quite to the point in terms of fighting HIV, for example, from something quite complex and technical issue and hospitalize it at some point people, but now can help to get access to care and treatment at a very decentralized level. It's really something that we are pushing in everything that we are doing. On the COVID-19, we have, of course, been engaged through what we call ACTA, and we can be more specific on that. ACTA is not a new entity, it's an organization. It's not an organization, properly speaking. It's a partnership between organizations that are involved in the global health, but focus on access to vaccine, diagnostic, therapeutic, and also health system strengthening for the fight against COVID. But I can be more explicit through another question later on. Thank you.
Thank you very much. Maybe we will move to Emma Hannay. You're the strategic advisor at FIND. The floor is yours.
Absolutely. I'll just take a minute or so just to put diagnostics testing in context for you all, because it typically is a bit of an under-recognized issue in global health, but never has it been such a burning hot topic on the front page of newspapers as it has been during the COVID pandemic. So diagnostic testing is one of the few tools that's actually in our hands already for the fight against COVID-19. And it's critical for being able to break the chains of transmission, to be able to isolate patients effectively, to be able to drive the pandemic at a national level, and to be able to have eyes and ears on the virus. And yet, sort of despite all of that, we know that there are substantial gaps in diagnostic testing infrastructure. So only about 1% of primary healthcare centers and about 14% of hospitals in many low middle income countries have access to just the basic tests that you need to be able to care for patients. And even where there is more advanced infrastructure in high-income countries, we've seen countries struggle to be able to respond to the peaks in demand that have happened from the pandemic. Then the challenges that drive all of these are sort of all along the value chain. And then this is where sort of FIND operates in collaboration with partners, several of which are on this call today. And that includes, work to basically intervene at the kind of more Wild West end of product development, which for diagnostics is much less regulated and structured than it is for other global health commodities. And we've seen this where there's been some pretty expensive mistakes that have been made by countries early on in the procurement of substandard tests. We've also seen the emergence of diagnostics nationalism, where there's been supply chain wars over access to diagnostic testing, where low-income countries have typically missed out. And often, even by the time a new diagnostic comes to market, the entire stock might have been reserved by some governments before development is even complete. And so it was on the background of that as Philippe talked about, the ACT Accelerator was launched at the end of April. The Diagnostics Pillar is co-convened by FIND and by the Global Fund, who I know we'll talk in a minute, and also includes a number of very active members, including Unitate. So you have a group of organizations on this call who are all linked and part of this larger partnership. And it aims to work end to end, from the R&D end right through to country deployment for diagnostic testing, and has achieved some key milestones already to date, including the launch of an end-to-end package to ensure access for low middle income countries to the newly approved antigen rapid diagnostic tests, which included a capacity reservation for LMICs of 120 million, funding from the Global Fund, policy guidance from WHO, and catalytic work from a number of partners, including Unitate, CHAI, and FIND. But I think certainly, just to say, the agenda for diagnostics continues to advance, and new areas that are emerging include things like being able to move to self-testing and home-based testing, to be able to move testing from being in a clinical environment to also being part of some of the new normal in COVID, to help school reopenings, border openings, workplace safety, and some of these broader issues that we're exploring as a partnership now. But I guess despite that big agenda, the fundraising under ACTA has been particularly challenging. So an investment case was laid out of what was needed for diagnostics for $6 billion, of which only $675 million has been achieved so far. So at the moment, I think we're really jeopardizing some of the potential that diagnostics can play in our COVID response. And maybe with that, I'll sort of pause. Hopefully I've touched on some of the key points for you, Simona.
Thank you so much, Emma. We have noticed that you mentioned ACTA and the ACTA Accelerator, so let's welcome another strong partner of the ACTA Accelerator, Françoise Vanny from the Global Fund. Françoise, thank you very much for being with us. The floor is yours.
Thank you, Sana. Thank you for the invitation, and thank you everyone for joining this afternoon. We are indeed very much involved in the ACT Accelerator and the fight against COVID-19 as the Global Fund. And perhaps I should just explain why. So the Global Fund, as a innovative public-private partnership created almost 20 years ago to fight AIDS, TB, and malaria in the poorest and most vulnerable countries, saw immediately how COVID-19 was about to destroy more than 10 years of progress and 10 years of results, so hardly won by the entire international community and all of our partners. COVID-19 could destroy it all just in a matter of months. And in fact, some of our partners modeling exercises showed at the beginning of the COVID-19 pandemic that the death related to AIDS, TB, and malaria could as much as double just in a question of 12 months. So in a way, we had no choice, and I think it was the same for all the partners across the ACT Accelerator, than to step up and say, okay, this is about us, this is about our mandate, this is about protecting what we've been working for the past few years. And it's also about uniting and making sure that we come together as an international community with the public donors, the governments, the private sector partners, the society community, the scientific community, pretty much everyone having to join forces to come with an end-to-end solution, as was just described earlier. So this is where we are coming from, kind of how do we make sure that we, as an international community, together fight COVID, as well as everything else that we've been working for so many years, and to make sure that the Sustainable Development Goals are not completely off track as a result of the pandemic. So a couple of things in terms of what we have done concretely. So we have jointly with others funded ACTA, and we are quite proud of the results so far, and I'm sure we'll be able to discuss that a little bit in more detail later on. But the other thing that we've been doing is to put in place some exceptional funding mechanisms to support the countries where the Global Fund has supports programs, to make sure that they were able to adapt their existing programs, and also that they would be able to expand their work in HTB Malaya to cope with the COVID-19 pandemic per se. So right from the beginning, during the pandemic, we put in place grant flexibilities and a specific mechanism for COVID-19 through which we have deployed more than $800 million at this point in time to do a few concrete things to reinforce national COVID-19 preparedness and response, whether it's prevention campaigns, protective equipment, oxygen, and these sort of things. Making sure also that health systems are strengthened immediately in the areas where they struggle most to cope with COVID-19, such as laboratory strengthening in particular, and also to mitigate the impact on HIV, TB, and malaria programs, ensuring that the different commodities that are needed to sustain the programs will continue to be provided to everyone, and including the most vulnerable. So perhaps I should stop here and welcome the conversation. Thanks.
Thank you, all of you, you were absolutely fantastic. We wanted you to have 15 minutes dedicated on this introduction, and that's great. We can say that probably Geneva was one of the epicenter of the pandemic in the last days. But as Sana said, Geneva is also the epicenter of the response against this pandemic. And you talk about data, about vaccine, about tests, about research, about diplomacy. Sometimes it appears to the lay public that the response needs some coordination, some collaboration. So I would like you to elaborate a bit more on how do you act yourself to more collaboration between your agencies, between your bodies, between your institutions. And if you agree, we will reverse the order. So we will start by Françoise and go backward. So please just tell us how at the Global Fund you are concerned by this issue of a better coordination, better collaborations, avoiding cacophony, and trying to make the answer more relevant and more powerful. Françoise.
Thank you very much, Professor Fleurot. I'm very pleased to be the first to answer that question, because this is actually our DNA. The Global Fund is a partnership, so we wouldn't be anything if we were not collaborating and joining forces with others. So, and we know that coordinating and collaborating actually delivers results. Over the past 20 years, together with our partners, we've saved 38 million lives from AIDS, TB, and malaria. So we know that works, first of all. Secondly, coordinating in Geneva, more particularly how that works for us. Very importantly, we normally, when we are not at home like today, we share a very nice global health campus with key partners, including Unitaid, but also Gavi and Stop TB and Rollback Malaya partnership. So we have an actual space in which we normally collaborate, which has now become virtual, but still we have a very strong relationship. Then ACTE, in a way, is an emanation of these partnerships and these connections that we have with other partners here in Geneva, WHO obviously, but also others on this call. And this really creates a platform for us as global health partners to come together easily and to come up with new ideas, like including ACTE as one of the most recent and perhaps most powerful examples that we have at the moment. The other thing is that it helps us go, I think, beyond global health, if that makes sense, because we know that the SDGs are all interconnected and we cannot work in silo. And when it comes to fighting COVID-19, obviously, we cannot work in silo either. We know it has economic consequences, social consequences, consequences in terms of violence against women, and so on and so forth. So having a place where we can actually have those conversations with other actors, such as, I'm thinking in particular about the human rights players here in Geneva, the humanitarian players here in Geneva, or policy makers, such as the interparliamentary UNEP, for example, is super important. That provides a sort of platform for coordination and collaboration that really matters, and that even more so currently. So we work within ACTE at the moment against COVID-19. Beyond that, we work across different global health partners as part of the Global Action Plan, which was created way before COVID to try and harmonize our approaches and support to countries. And we work with others across the development and let's say the SDGs agenda to try and address complex issues in a coordinated manner. So I'll stop here to let colleagues also complement. Thanks.
Thank you, Françoise. And what about FIND? So Emma, would you say you are a neighbor of our Institute of Global Health at the Campus Biotech, and we are very familiar to meet each other usually when we are not at home like now. But how do you see the role of FIND in this collaborative initiative?
So I think COVID has brought some really interesting opportunities to the table for partnership. You're probably familiar with the old adage that if you go faster, you go alone, but to go further, you go together. And I think with COVID, you have to do both at the same time. So create partnerships that allow you to go faster together and further together. And I think there's some interesting pieces to this. Normally in global health, forming a partnership, and others who are on this call can probably speak to this better than I, it takes time, right, to establish norms, priorities, and working areas. And all of that has been massively condensed down in COVID to a course of sort of hours to days instead of months to years. Things that used to be sequential, so a sequential process of developing priorities and then implementing them, starts getting mixed up where we have to do everything together in order to be able to respond to the significant global health crisis that is COVID. I think a lot of the recipes that help work are having a really clear shared agenda and also talking together often. Philippe and I were joking that we hadn't spoken today and that this was unusual. So it has to be this sort of really close, I think, connection between organizations, which, as François says, has basically moved entirely online with some of the limitations in access in Geneva. And, I think for diagnostics, it's a real concrete issue for people, both in their, own home environments as well as part of their work. We've been doing troubleshooting for diagnostics access in low middle income countries, but we've also been doing troubleshooting to be able to expand the access for diagnostic testing in Geneva. So it's become this incredible local issue as well.
Thank you, Emma. And we are fortunate enough to have the executive director of Unitaid, who is a new executive director. So maybe you have a deep experience in this international organization in Geneva. So how do you foresee this collaborative way for Unitaid in the near future with all these ecosystems, which is here in Geneva?
Well, I think first, I just want to build on what was said by Emma and Françoise. I think that it's not a surprise for us. I mean, we are all in Geneva, sometimes in the same building, but we have the experience to work together. So it has been over the last 10 to 15 years, something as an example for Unitaid, the strategy, the selection of intervention, the implementation is developed and shared, for example, with the Global Fund, but also with Gates Foundation, with others. So there is no surprise in terms of working together. We have a very close relationship with FIND also in the diagnostic for a long time, and we have been quite successful also for HIV, for HCV, and more is coming. So when we have been confronted for the COVID-19, in a way, the fact that people said, we don't want, the donors in particular, said, we don't want to create a new organization, but can you work together? I think that we said, yes, we can. And even we can build other type of partnership One other thing is that in that ACTA, I think that we are, as UNITED, the only one UN thing, even if it's a partnership from WHO. WHO is fully involved also in that, but the rest are Swiss foundation, most of them, or foundation from the UK in the case of Wellcome Trust. But regardless to the status of the organization, I think that we have been coming together very easily because of the work that we have been doing for a lot of time, very, very fast on what are the goals, what are the priorities, what is the vision of the work, how this is really playing together. And I have to say it's in a way unprecedented. And I want just to flag that. At the level of speed and precision. And Emma said that we need to go fast and to go very also thinking about the long-term consequences. It's exactly where we are. I think one note, I think, which is not working so well is the funding. And this is a critical issue, I think. One thing I want to flag, because it's a part of the discussion we have with the principal every Thursday evening. We have a meeting with all the principals, so it's unusual. Nobody can expect that you have all the principals from the organization meeting every week, but we are doing that. And it's also part of the success because we are very close. I mean, we can pick the phone when we have an issue. I can talk to Peter at the same time, or Katarina, or Steph, or anybody, or Jeremy Farrell from Wellcome Trust, and say, "Oh, we have to face that. How can we find a solution?" And we find the solutions. But one of the question of the funding is it was started with a pledge from the European Commission, and it was quite successful, but it has been clear over the summer that in fact the money was not there. So we need still to have a transformation from pledge to cash, and also to pay attention to vaccine. It's a very important tool. And as you know, there is very good news since last week with Pfizer, today with Moderna, with some kind of preliminary data that is really promising. But in all cases, we need to recognize for many reasons, and we can be more specific, that we need not just the vaccine. We need also treatment, we need also diagnostic, we need also the way to connect on what is happening in the country, specifically in LMICs, because you cannot just expect that the innovation that we are working on with the company will be very easy to use by a lot of countries. And I think that one of the lessons learned also from that is the fact that the challenge in COVID-19 is that it's not just a question for the South. It's a global question for any country to have a strategy in terms of how do you think about how to use the vaccines when available. The same for the treatment, how to have a very a strategy, a clear strategy in terms of testing. And we know the challenge in all the countries. So I think there is no country in the world that can say, yes, this is the way everybody should do it. So it's also part of the work that we are doing under ACTA is to provide not support for clinical research, but how the strategy and the learning can be done at real time. And it's something that we discuss couple of weeks every week, many times with our partners, Fund, Global Fund, and others. And I want just to flag that. But again, one of the key issues is the funding. Funding will be the key, and the fact that the way it is organized so far, that we have to compete in a way, even if we don't want to explain the difference between treatment and diagnostic. And we are all saying that, you know what, the question is to have access, equitable access to all of these tools. If not, we will be in trouble.
Yes, thank you, Philippe. Very fascinating talks, the three of you. And if I can say that you are, all the three of you, the usual suspect of global health in Geneva. What is less obvious is to see the CERN here around the table. And to some extent, EPFL, we will see, and ETH Zurich, we will see that after. But Manuela, yes, I'm not so sure all the audience here is very familiar to the fact that the CERN is involved in any aspect of health. So will you contribute? Are you contributing to challenges like the COVID pandemic? In a way, the CERN may bring something which is not brought by the usual academic community?
Yeah, so it's well, if you want, it shouldn't come as a total surprise because we have been developing medical application technologies for a long time. There's a connection between modern medicine, radiotherapy, imaging, etc., and particle physics technologies. But I think really resonates what Emma was saying about the acceleration of everything that happened with the COVID situation. So the fact that we became partner of the Geneva Health Forum already since last year, it's also an expression of our interest in making our technologies and know-how known to the global health scene and try to see what we can bring there. And then I think, yeah, we were all surprised, like everyone else, by the amplitude of the problem and also by the immediate response from our community. Everybody wanted to do something. So we, by nature, particle physics is highly collaborative. We are talking about experiments with thousands of people. There's thousands of people normally in normal times on the CERN site. We also learned during the years that we need the input from the expert communities, the medical communities for medical applications. But to put all of this together with the rhythm of the pandemic was certainly not easy. So for us, there were internal actions, the setting up of the task force. The Geneva Health Forum has been really a major platform for us to connect quickly with the actors in Geneva and beyond, honestly. And there were different challenges along the way. So on one hand, there were, if you want, even very practical logistic challenges. We've been distributing hydroalcoholic gel that was produced on the CERN site. I think we are up to 6,000 liters that were distributed to the community. Thousands of visors and face shields produced by us and distributed. And when people in the local area started learning that CERN had these resources, so the request had to be organized across France and Switzerland, the help from our emergency response team to the local ambulance services, etc. So there was a very, very practical issue. And then there were issues that had to do more with how to contribute meaningfully. You were talking about how to, extract the good directions from all of the cacophony at times of the different signals and different requests. And a couple of examples I can make. One is we developed, some of our physicists developed in-house a high-energy ventilator, how they call it. So it went very quickly. They started assembling it in March 27. They finished the first prototype by the end of April. So this shows that, if you want to do something quick and in emergency, we know how to do it. But then to find a proper way for this ventilator in the medical world, that's a challenge that is still ongoing. So we liaise with the WHO. We are liaising with industries that could possibly bring this into hospital settings and into a medical reality. And then there's the major, I would say, topic of everything that is related to data, both data handling, data analytics, etc., where we have a lot to contribute. One of our keywords has always been open. CERN is the home of open science, so a lot of our open tools have been used broadly by the community, including, for example, Zenodo, the repository for open to everyone for any research results, etc., that could be shared. We created immediately a portal dedicated to COVID to try and channel at least the researchers. But there is really, I think, a wealth of competencies and know-how that we have, and we need to find the good way of making it usable by the global health community. One example is, Antoine, is the collaboration we are having with the Institute for Global Health, using one of our tools for epidemiological modeling. But I think that this is really the challenge for us to build and continue to maintain these bridges with the global health community in Geneva and beyond to be able to make an impact, really.
Thank you, Manuela. I really do think in listening to you that this ecosystem in Geneva may benefit from the tools, if not of tomorrow, at least of today, and not the old-fashioned tool for trying to solving epidemics. And Christine, in the same spirit, you belong to this data science, Swiss Data Science Center, which is quite per se, it's a quite innovative initiative because it's a joint initiative between the two engineering schools of Switzerland in Zurich and in Lausanne. And I know, of course, we have almost daily contact and connections working together. So your commitment for global health is huge. It's all your career and experience also. But can you develop a bit more? Because I know that you also work with a task force. You work with many other bodies in Switzerland. So trying to help understanding better this pandemic. So can you elaborate a bit more on what do you think about that and how it moves forward?
Yes, thank you so much, Antoine. So I think there are like three different layers of what we're trying to achieve. So if you remember how the situation was in February or like January or February, there was the beginning of a pandemic. There was also terrible a pandemic also in the data itself, like the data quality was terrible, and a lot of effort was spent trying to understand which data we could trust, which data we could use, which data we could reuse, and so we started thinking in like three levels of collaboration where data science could help. First, it was a collaboration between data scientists themselves, because it was a very humbling experience for many people who had never experienced poor data quality with like that is being reported even by, say, developed countries that would not report data the way you would expect. And so the first thing was, can we work with people data curation with people from data repositories, as Manuela said, from Zenodo or from the Dataverse and from other sources, to have data that we can curate together and trust, and then data on which we can actually build models. So that was the first layer. So data scientists between EPFL and ETH trying, and across Switzerland, and also with our colleagues in the US, trying to understand what were the correct data sources, and then which insights we wanted to get from them. And this is where we actually added the second layer of collaboration, which was with domain experts, and that was actually with you, Antoine, sort of by chance, as a Twitter type of meeting, where I think we wanted to help with questions that seem maybe obvious, like where do we stand today? Where are we? Are we in the first wave, the second wave? Are we going up? Are we going down? Not in 2 months or 3 months or 2 years, but in 10 days, next week, what's happening? Is it flat? Is it exploding? Is it going down? And so we're collaborating with the Institute of Global Health and to try to understand whether the modeling skills that we had as data scientists and machine learning experts could be used to answer relevant questions. And that's something we spent quite a lot of time, because we noticed that, for example, some countries don't report numbers on weekends. And that might be something very trivial, but it breaks forecasting tools in a terrible way. And so we really had to spend months fine-tuning models that should be simple, but they are not, because of a lot of issues with data quality. And the third layer of collaboration is with the public, and it's making sure that all the findings that we have are open to collaborations and open to scrutiny. And that's why we have like a public dashboard we also work with WHO Afro, and they can reuse the platforms and the toolings that we use. And in terms of the collaboration with the task force, we also make available the next step of a research data platform where we link open data with data that is more restricted in terms of access. And so we work with BAG, so the Federal Office of Public Health, to help build these platforms where we can actually generate insights without having to spend so much time downloading, curating, etc., the data itself. And as Philippe mentioned, maybe in a different context, but for us also, finding long-term funding is potentially a problem, because a lot of the work is done pro bono by many people, evenings, weekends, etc. And a long-term data strategy for the pandemic would need also like a global collaborations, and this is hard to achieve.
Christine, we should at this stage recognize that all of these actors represented today have not shifted from their core business to fight against COVID-19, but they mobilized their team, as you said, Christine, over the weekend, the night, the evening, all the days, in addition to their job, which are very important too. So we'd like to thank you for your dedication and for all teams working in this front. At this stage, I have also a question. I don't know how many of you would like to answer, but you are all currently contributing to the response and to push for research and defining new tools against COVID-19. What kind of challenges, key challenges for the implementation do you already have in mind? And if you have already advices, proposals to face them? Who would like to answer this question?
Maybe I can start throwing a couple of things on the table because I don't think we can have all the answers at CERN. Again, for me, I know that everything that is related to computing, data analysis projects is where, and I'm sure that Christine, I see her nodding, as APFL, you have exactly the same experience. There's been a mobilization at the worldwide level of physicists and data scientists all over wanted to do something, and they want to know what they can do to help. So I do think that here there's a huge untapped potential in terms of volunteer work. It's true, a lot of people are working on these activities, and the majority of the people were doing this on top of their normal work. They're doing it at night, over the weekend, because they want to contribute. And what I love about this aspect is that it goes against a bit the scientists closed in their ivory tower. They are not at all. They're very well aware of what happens in the world. They need to be channeled in their energies and their willingness. And maybe the other topic that I would like to quote, because it's a special topic on which we are working at the moment, is the topic of the waste management. So, with the PPEs, we are producing a lot of waste that is in many cases has a lot of viral or microbial charges. So it poses a challenge for the management. And of course, one of the ways to handle this is also through ionizing radiation. So on top of exploring ways like UV sterilization we could apply at CERN, we're also exploring this. And this is another topic in which a coordination among different labs working on this is very useful. But if you want, it's a closer playground to our usual ones. So here we are more capable of bringing the actors together.
Thank you, Manuela. Françoise, go ahead.
To jump in if possible. I mean, first of all, to say that it's fascinating to hear what EPFL and the CERN are doing. It's just a world of possibilities that suddenly becomes visible, and it's fascinating. So thank you for sharing that. On the question you asked, Anna, around the challenges in terms of implementation, one of the key ones is equitable allocation of certain tools. We are not going to end this pandemic and return to some sense of normalcy if we don't beat the virus everywhere. And therefore, from a human rights perspective, but also from a very pragmatic perspective, perspective, the equitable allocation of any new tool that comes to life is extremely important and a huge challenge at the moment. The other one with the flag has been mentioned already is funding. Obviously, because to take innovations at scale and make sure that they reach everyone who needs them requires funding, and it's not here yet. And perhaps alongside funding, leadership. Normally, funding follows leadership, right? And leadership globally, but also in countries, and from public and private and civil society perspective alike. We need leadership, we need vision. And perhaps the last one I would mention in terms of challenges, it's obviously the country preparedness, right? It's not easy, and I'm sure Philippe and others might want to comment on that, but it's not, you're not dumping innovation onto countries, right? You need the systems, you need the capacities, you need the data system, you need people in all ranges of spaces of the health system, including community systems, to actually deploy such tools. And this is where investments, we are facing sort of structural challenges with the things that have not been strengthened enough in the past, and that we now need to boost very, very quickly to make sure that innovative tools can actually be deployed effectively and reach everyone, including the last mile, which is really the most difficult, but very important if you want to beat COVID-19 for long. Thanks.
Maybe I can add on that.
Go ahead, Philippe.
Thank you. So I think Françoise made a very important point in terms of innovation. And again, just to push a little bit, we need to realize that innovation is not something that you should have or make on. It's critical for the response. Everything that you can do in public health should be looked also through the angle of what new things can bring. And again, it's about simplification, it's about transformation, it's about acceleration. But I think that we underestimate the transformation part of it. It's about the people, how many people you can reach, how you can put their health into the hand of the people through the communities. Emma knows very well about the self-test and also the Global Fund, because we introduced that for HIV, and we discovered, it was part of the implementation, that men benefit directly from that because they are not reached by the health facilities. So you change dynamics, and it's not just about the product, it's about the skills, the people, the access to information, and change absolutely the dynamic, and to have something that you can have better quality, you can have efficiency, value for money if you make it right. And that's something that, of course, United believes, but it's also the case for Global Fund and FINE and others. And I think that's something that is not that explicit. So I would say that Geneva is the epicenter of the response for COVID in global health, but also an epicenter for innovation in global health, which is key if you want to be serious in addressing the SDG, but also fighting COVID-19. And in something, again, we have so many examples altogether that should be more known, and I think it's quite important to make that point.
Just to echo Philippe's, I think a lot of the work that needs to be done is about cutting through all the complexity down to kind of simple, straightforward pathways that countries and others can take and follow. In diagnostics, we're monitoring this incredibly vibrant pipeline of 800 odd tests or more under development. But where some of the biggest challenges were really around knowing which tests were of high quality, which tests could be manufactured at scale at the kind of prices that meant that countries take them up. And I think that's what the partnership approach approach that we've used under ACTA tries to do, right, is to take all of that incredibly complicated, changing, rapid landscape to be able to create a pathway, a set of priorities that could really make a difference on the ground. And trends like sort of we're starting to see where diagnostics isn't just an issue of the health system, but an issue of sort of society more largely. I think they'll pose sort of new challenges for us when it comes to innovation, because a lot of our kind of structures and thinking are very much focused on clinical care within the health system. So diagnostic testing, for example, outside the health system will require a sort of a new set of thinking and competencies for all of us.
Okay, maybe I have a last question for you. And just like an advice for your future yourself. What would be the only thing that you can just send one advice? So what kind of advice to yourself in the future you'd like to send? One thing you would like to keep in these systems, one thing we would like to reinforce or to enforce or maybe to avoid for the future? What would be your answer? Who would like to start?
I can start.
Thank
I
you.
think for me, it's very clear that my advice for me, but for the organization, is that we need to learn every day. We cannot think that we have any solution, and the only advice that makes sense yesterday, today, and for the future is to learn. And my passion for what I'm doing is this learning from the team, learning from the partners, learning from the countries is absolutely key in the work that we are doing, because we don't have the solution. We need to recognize that ideas are not with us. We may have ideas, but is that not important? What is more relevant is to find ideas outside and make sure that they can work and develop it properly. So that's my advice for myself, but may be interesting for others also.
Thank you, Philippe.
I think my advice to myself would not be so different as what has been since I moved from, let's say, being a researcher in particle physics to working on the transfer of technologies to medical applications, is that the links with the real actors in the medical field, going there without prejudice, without thinking that, we know your problems, here's the solution. This type of attitude is what we should really keep pushing, and it has become, let's say, the normal attitude for all non-medical scientists willing to help. That for me is it's one of the first things that I learned when I started doing this job, and I think it's still probably the major advice to all of my community around.
Very interesting. Thank you. Who would like to jump in?
I'm happy to. Perhaps following from what my colleagues have said in terms of the learning and the connecting, I had sort of written on my notebook the listening, because we are all sort of indeed learning, but we all also sort of disconnect because we cannot travel, because we cannot go around, and we need to proactively listen to make sure that we understand what is going on and that we can really adapt our responses to the realities on the ground, obviously, because this is what matters at the end of the day, right? To save lives everywhere. So for me, there is the listening actively, and the other one is about let's not start from scratch either. The point that was made earlier, it's not about starting from scratch and as if we had not worked before, or as if we didn't know anything, or as if we didn't have partners before. And let's try and build on what we already know and the networks that are out there, instead of trying to design something completely in the middle of the crisis, which is not really helpful. So build on what we have and listen would be my two advice to myself.
Thank you very much, Françoise. Maybe Emma?
I think one thing, and call on a thread related to what others have said, is around the fact that COVID pushes us to a situation of having to make decisions under a situation of uncertainty and under ever-changing situations. And I think the other thing that COVID pushes us to do is to sort of default to action versus default to inertia. And I think the thing that would be great for us to keep is that default to action and that kind of environment of kind of rapid decision-making in situations of uncertainty, rather than perhaps waiting until the eventual perfect answer is available. So I think that's one sort of set of mindset things that I hope sticks with us over the longer term. I think the other thing is, of course, and I think a few of us have alluded to this, the sort of breakdown of these sort of classic institutional barriers and the sort of very close day-to-day collaboration, which has always been a part of these long-term partnerships. But COVID, I think, has forced it to be a much more tightly knit partnership. And hopefully we can keep that going forward as well.
Thank you so much, Emma. Christine?
And maybe, yes, the last words of Sami wisdoms to follow on what Emma was saying. Like, I would say I would want more action and less trying to fix what isn't going well. So we've been spending months, us, but like many people in modeling, trying to compensate for terrible data, for terrible interoperability. And we could, instead of trying to fix things, we could also team up and demand better data quality and better openness from different stakeholders. And that's something it's a path I should have explored, let's say, last year, instead of trying to fix things the math way. It's like big data provided this type of approach.
Okay, thank you, all of you. Our dear guest speakers, you were brilliant and your thoughts were absolutely fantastic. Time is changing, and Philippe, I would say that we should become vigilant for the next edition, because the gender balance in this session was not really high level, so we need to be very vigilant, I think. But what this table showed to all of us is that we act better together than alone. And really, your collaboration sounds promising. And I would say that this pandemic brings some new actors around the table. And probably it is something which will benefit to global health for the future, and maybe sustainably. Okay, so we don't want to continue too much. I think time is almost over, and you were also perfect in time, keeping space and time for all the others. We appreciate it a lot. Sana, thank you.
Thank you
also,
so much.
in your busy agenda, you accepted to come and to join. We would like to thank all the participants coming from more than 80 countries. And also, we would like to give the floor now to you for the last words, probably. Thank you.
I'd just like to pick up on that point and echo your thoughts. Once again, a big thank you to everyone who joined us online, as well as to our expert moderators. Our next discussion begins in just 15 minutes, so that's enough time for a quick coffee break. This time it's all about promoting expert patients as co-creators as well as disseminators. And our expert leading that discussion will be Ariane Alcorta. We'll see you very shortly. Thank you very much.